Neil Haley Show and the Mike Crook Show with our host, Mike Crook. Mike, we're going to continue the conversation with great health tips and strategies and different products. And we're excited about our guests today.
Well, yeah, we've got back with us Dr. Joe Duggar from Searcy, Arkansas, and Darren Fryer from Hawaii. We have to do these recordings late in the afternoon because Darren's asleep in the morning time. We normally do at night. That's just the way it goes. So last time we had Darren on, we talked about the P90 Plus machine, and you need to go back and watch that video. It is amazing some of the things that happen. Now, I have had almost 2 weeks worth of use of two of the machines. I haven't tried some of the others yet. They're here, but I just haven't tried them. And the P90 Plus, at first I've been noticing my sensitivity of what I'll call neuropathy. My wife says, yes, Mike, nurse says it's neuropathy. I've never called it that, but neuropathy. I'd come off the ladder many years ago, hit the ground hard on my feet. Think I did some nerve damage to my feet, and they've just had this pain and sensitivity and hard to walk without shoes in it for a long while. Nothing I've done, and I've done a lot of things, has done anything for them. But this has increased the sensitivity, so it's gotten hypersensitized being on the P90 Plus machine, and I'm assuming that means it's getting well. It's that the nerves are going back to normal where they should be and such. So that's my experience with it. I've had some great sleep, some amazing dreams while on it. I mean, just very vivid dreams. Wake up and just think I'm really there, in those dreams, and some other probably symptoms of what it's doing for me that I really am not paying attention to. But those were the things I wanted to focus on, was the feet. Primarily, some lower back pain has seemed to go away. So I'm getting results out of it. But one of the things I'm most excited about is this belt that I don't know if you can see it on my camera, but it's a nice size belt that you wear, and it is a massager that causes you to lose weight, burn fat. So I want to welcome again our guest. Darren, first tell us about what this does, this machine, because it's doing some things that you explained. It's got like 7 different modalities of treatment that's doing.
Yeah, so that's called the shaken massager, but it's not just a massager. That's just what they named it for the US market. But it's really a smart frequency-based weight loss device. So it does do 7 modalities in one, all designed to target that visceral, stubborn belly fat. Visceral fat is the toxic fat around your internal organs that tends to hold on to a lot of the toxins we absorb from our environment. So the 7 things that it does: pulsed electromagnetic field targeted directly on the spot that you set the belt in, which generally you set it on your lower waist. Ultrasound, radio frequency, there's a red light in it, and it also does heat, vibration, and massage. So all 7 of those simultaneously happening when you're in the body shaping mode on level 3, which is
So turned it on, and I figured out that the red lights don't come on unless it sees skin.
Yeah.
It has to see skin to do it. One other day it wasn't turning on for me. I wonder why in the world wasn't turning on. But when this thing covers and gets skin,
it has a sensor.
The red lights come on. Anyways.
Yeah, so it does all 7 in one. It's about 20 minutes per session, but it is rechargeable with a USB-C cable. So we usually charge it at night, and it's good for about 10 full 20-minute sessions throughout the day. So me and my fiance usually share it, do a couple sessions, one on the front of our stomach, one on our lower back, especially if we're working or on the computer or driving a lot. It helps a lot with lower back pain. And a lot of side effects that are positive. I mean, it's, a lot of women say it helps them a lot with their time of the month, their cramps, digestion. There's times where we'll eat a whole bunch of food and we'll be all bloated, and we throw the shaken massager on and immediately all the bloat disappears. But those are just kind of positive side effects. The main device, the main purpose is to really target visceral fat cells directly and really burn and melt those fat cells away. And we have a lot of doctors and a lot of gym owners who have the in-body readers who actually track people's calorie burn. They tell us that it burns 500 calories. And when I first heard that, I was like, that seems crazy. But they actually told us, because they've been testing it with the high-end in-body readers, actually burns like 600 to 700 calories occasionally. So that in 20 minutes. It's pretty incredible.
That is amazing.
Yeah.
It's
And do you see anything like this, Darren, out there in the market?
I've never heard of anything like it. That's why when I first saw them launch the product, it was just like, oh, I don't know. But, as I got into the company and started using all their devices, I realized everything they make is very legit. All these flagship devices, as I mentioned in the last podcast, our company has over 1,000 global patents across their products. And they really only have several flagship products. So each of these products, the shake and massager included, over 100 global patents on that technology and on that specific device and all the features. So yeah, it's nothing I've ever heard of or seen, but it makes total sense to me. And the results and testimonies are very consistent, especially with people in the very high body fat range. I mean, the more fat you have, the faster that belt really works. But even if you are kind of at a mid healthy range of body fat, it still produces some incredible results.
Is it burning any fat that's in the non-visceral world? I mean, is it all fat, or is it's just the visceral fat?
I would assume it does burn all the fat. I mean, the primary focus is for it to penetrate deep enough to get the visceral fat. But if it's getting to the visceral fat, which is more deeper in your body, it's definitely going through and burning the external fat as well. But yeah, it's designed really to get deep into the body. Generally, those love handles are very hard to manage and to work towards. And yeah, generally the protocol is you do 20 minutes with a shake and massager, and then you hop on the P90 Plus afterwards. Because what the massager did was it targeted and melted the visceral fat cells, and then the P90 Plus, the circulation increase from the terahertz causes your body to really help detoxify all those melted fat cells out of your system. So that's
should you do
protocol.
both at the same time? Should you do both at the same time?
No, it's not recommended to do both at the same time. It's better to do the shaken first, just because it is a more powerful machine. It's not recommended to do together because potentially the frequencies from the P90 Plus are very powerful. So you don't want that to go in and mess with any of the electronics inside the shake and massager. You can use like the goggles at the same time because they're all the way up on your head and it's not as powerful as the device. But we've had people do them at the same time, but it's just not recommended. It's better to do the shake and massager before you hop on the P90 Plus. So that way those fat cells are already burned, and then the P90 Plus will help you detoxify that out of your body.
Now, Dr. Duggar, our audience knows you from our video and interview you of working with the stem cell activator from LifeWave, the X39, and of course we'll say that Dr. Duggar is a practicing physician in Searcy, Arkansas. He's not your doctor. He's not giving you doctor advice today. He's just here telling about how this works in his practice, what he's seen with patients along the way too. But shifting gears here off of the weight loss device, because I don't know what your experience is on that, but tell me how you got to, because you introduced these devices to me. How did you get to this point in time where you said, this is something I need to try? You were telling me something about your son. So remind me, and let's go back there for a minute.
Right. Yeah. So Todd, my younger son, just finished his last season of college football last fall. And, he had torn his ACL in the first round of the playoffs. And so we were looking at every possible avenue to get him back on the field. He was using stem cell activation with the X39 LifeWave patch and some others. And he'd been doing that for a couple of years, had some injuries that had healed pretty quickly with that. He had torn labrums in both shoulders. Within a couple of weeks of starting using the stem cell activation, he got back full range of motion, no pain, wasn't taking any ibuprofen again, was able to do bench press heavy. So he was able to recover quickly from some pretty significant soft tissue injuries. But with the ACL tear, they were hoping to play to the finals, and they did. They made it to the final game. So he had another 3 or 4 games that he was going to be able to be a part of if he could get back on the field. Of course, surgery wasn't even an option because, he couldn't be able to get surgery and play at all. So, he was able to get back and was pretty much full speed in 2 weeks, which is phenomenal. But we were looking at every possible scenario to heal soft tissue injuries. And so I looked at PEMF, pulsed electromagnetic field. I'd heard a little bit about it and was really impressed with all the studies. It's been around for a long time. Darren is really expert in telling you the history on PEMF and how it started, in the late 1970s. NASA actually came up with the technology, but we've got a lot of data on that. And there's a lot of data that shows that it accelerates the healing of bone and ligaments and tendons. And these soft tissue injuries are very notoriously hard to heal, and sometimes they don't heal. So, and then when I found out about Ollie Life, this company, there's nothing else like it. And we're talking about this shake and massager, but
Right.
PEMF, is just very, very expensive to get. You can get professional sports teams and maybe some big medical centers. I don't even know if we have in Arkansas, if we have a medical center that has a PEMF device, but typically they're extremely expensive if you get treatments. So this is the first, indication of any kind of technology like this where you could take it home, use it at home, and it was very affordable just to buy the equipment and have it on your own. And so we started using the P90 Plus. Ty did, and we all started using it then. But and really, so he did it a little bit before his surgery. He had ACL repair 8 weeks ago, I guess. And he was using the P90 Plus for 2 or 3 weeks before his surgery, kind of as a prehab technique. And then he had his surgery. He saw the physical therapist the next day, which is what his surgeon wanted him to do. So post-op day 1, he's seeing the physical therapist to get some movement. The physical therapist gets this 15, 20 degrees range of motion beyond what he's expected to get. And he's like, well, we better stop there because I'm a little uncomfortable doing that. I've never seen that before. He said, usually, you get 2 or 3 degrees, 4 degrees of motion, and that's it. So within 2 weeks, he had full range of motion of that knee that he had surgery on. And usually that's a, 6 to 8 week process to get there. And that's if someone's recovering well. So phenomenal results with it. And he's really full speed now. He's waiting for his surgeon to tell him that his graft has healed. And so even the surgeon who knows about PEMF, he's Alabama's team doctor. He's a great surgeon. He's really impressed with what's going on. He's just never seen anything like this before.
So I was bringing up a screen on ACL tears, and I don't know if I can share my screen yet. Can I do that?
Just push it and then it should work.
Okay. I always am bad on this.
Okay, good.
There we go.
All right. So this is it's probably the better picture there. It's in the middle of your knee. And it's a tendon there that's just torn. Did he have arthroscopic surgery? Is that how they do it?
Yeah, he had arthroscopic surgery, so small scope and small incisions. Took the center of his patellar tendon just below the kneecap and cut out a piece of that and then sewed that back together and used that as the graft to reconstruct his ACL.
To reconnect them. That's amazing surgery that they do. I'm constantly amazed by those things like that. But anyway, so that is done, and his recovery is just exponentially improved. So
Right.
amazing things there. What else are you seeing in your world with what it's doing? Is it doing anything for other members of your family, or using it in your clinic any yet, or what's going on there?
Yes, we're very early into it, so we've not had it very long, and in the family and personally, better sleep for sure. Recovery time is much better after exercise or working out.
You do a crazy workout, so yeah. You're like the to borrow the P90 from that. It's like you do that, jump exercise stuff with it's crazy stuff that I can't even do. And I'm younger, but not younger. I'm older, but I've just been doing exercise for a while, but not that kind of stuff. I imagine your recovery needs to be enhanced. So it's
yeah, for sure. And then we're seeing, even with mood, anxiety and depression, we're seeing good results fairly quickly again. So that was one of the things that I was a little bit surprised about when I started researching PEMF was all the data out there that shows that it can improve mood disorders and specifically depression. So, for me, it's another tool, a really good tool to use now that it's affordable and people can, buy their own equipment and take it home and use it at home. It's something else we can use to avoid using medications and drugs and surgeries in some cases. And then one other remarkable thing you'd mentioned, well, two others, I guess. You'd mentioned neuropathy. We're seeing some good results with that, and people who've had neuropathy for decades and nothing's helped them. And this is the first thing they've ever used that's actually helped them. So a lot of excitement about that. And then post-stroke, have one patient who has just done a couple of treatments. They haven't got their own machine yet, and access to getting to it is a problem for them. But hopefully they're going to be able to figure out a way to get that and get it started. But he's getting some response already with the side of his body that's not moved since the stroke or not moved well. He's already seeing some increased movement. And so, it's helping to reestablish those neural pathways with the muscle and the nerve and the brain. And so you're seeing people who've not had movement or have had limited movement in an extremity, a leg or arm, that, maybe for years, that are now getting that back. And sometimes even within the first time they get treated. So pretty remarkable with what we're seeing in that regard.
It's amazing. I'm trying to get a local guy here who was injured in a motorcycle accident to get on the P90 Plus and see what results he could get. I'm just, for right now, I'm just, if somebody wants to come by and use it here at the house, I'm allowing them to do so. But otherwise, so let's talk about cost for a second. You said it was fairly economical. So this machine, the massager, the weight loss machine, and Darren, you can help us on this, but to your door, delivered to your door, about what does this cost out of pocket, shipping and everything? So
yeah, so the shaken massager is $1,000, and then right now, the tax and shipping is all kind of a flat rate globally, so about 10% extra for tax and shipping. So out the door for the shaken massager, $1,100 US exactly.
Okay, so now if I went to a practitioner and had a treatment for sculpting, they call it, that where they put a thing on you and did stuff to freeze your fat cells or do whatever else like that. And I had one before because I was again trying to deal with the same thing, the love handles and those things like that. Over $1,000, if I remember correctly, several years back, it was almost $1,600. So, for the price of one visit, you get your own machine that can cause you to have not just simply because I don't recall it treating visceral fat. I think it was only for the fat there. It was supposed to be destroying the fat cells there. Dr. Duggar, do you know much about those machines? Have you ever looked into them?
Yeah. Yeah. So there's different kinds. Most of them use a laser of some sort, a green light laser. Some will use red light as well. And they basically cause the fat cells to rupture. And so that ruptured fat cell then gets resorbed by the body. And yeah, visceral fat is part of that, but it's not as easy to get the visceral fat. It's usually more the superficial, what they call subcutaneous, just under the skin, that gets affected by that.
And treatment costs on those, typically what I'm saying, about $1,600 for one treatment.
That's on the low end. Yeah. I mean, if you're getting a high end treatment, when I say high end, the more expensive the device, the better it works typically, but then the more they'll charge for treatments. And what I see typically is packages. People will sell a package of 10 or 12 treatments over the course of a month or 2 months. And those packages can run from $2,500 to $4,000 or $5,000 for one package. And, and then the thing is, you probably have to get repeat treatments down the road, just depending on how you respond to them.
So what happens to those fat cells that are ruptured or destroyed? I'm assuming this is doing some of the same things, but what happens to them? I mean, they're absorbed by the body, but did they ever get replaced as the body, or do your just remaining fat cells just absorb more fat?
Well, yeah, your remaining fat cells can absorb more fat. Your body can regenerate fat cells too, so you can get more. And it's a matter of, that's really the challenge, I think, in treating any kind of fat. If you're trying to get, like what you're talking about, a certain area, love handles or visceral fat, the challenge is typically trying to focus on one area and say, okay, here's the area that I want to lose the fat in. And so, again, this shaken belt actually does that. It actually focuses visceral fats, the best thing you can get rid of. So, I mean, I think that's probably one of the best things about it.
And so, Darren, what was the price again to your
So,
house?
yeah, $1,100 out the door, including the tax and shipping for that.
Yeah, I mean, so I can't imagine anybody getting something at any practitioner's office that's going to be a higher end deal that's going to meet what this is for the dollar, and you get to use it over and over again. The point I was making is that the fat's going to come back, and you've got to continue to use the belt, or got to continue to get the treatments.
Yeah.
And it's great, but it just doesn't, it doesn't end there. And so having it on hand is a great thing to do. How are sales in the U.S. with this stuff going so far?
It's going really good. If I had to guess, we're probably on our way to about 15 million in sales. No, I think I saw them make a post. Maybe we broke 20 million in sales in the US, and the products just started hitting the market last summer. But back then there was a lot of logistical stuff they were figuring it out. So machines were taking, 3 to 5 weeks to arrive. Now actually machines land in about 5 to 8 days or less. Like in Florida, people are getting machines within the week. We got third-party warehouses in Florida and Fort Lauderdale, one in Los Angeles. We have our North American corporate office headquarters slated to open this summer, 2026. But very early on. I mean, a lot of that volume is really just in Hawaii, where it started to blow up originally because of the testimonies with neuropathy and gout and all these things that just spread word of mouth. So a lot of the volume, probably 80% of that volume, is just out of Hawaii, mostly from Oahu, from all the islanders and the Polynesians. They suffer a lot of circulation issues, varicose veins, kind of losing coloration in their skin. So it blew up really amongst that. A lot of the retired kind of islander community out here. So very, very untapped in the whole North American continent, Canada, US, Europe, all over. So.
Well, the bottom line is it has to be working, or else you don't get that much sales in a year's time. Nobody does the volume in a year's time. So great to hear. Any other information, Dr. Duggar? I know we're going to run out of time here very quickly.
We haven't mentioned the goggles. I would say if you didn't talk about that at all last week, let Darren briefly talk about it. But we're seeing with the goggles a really good response with migraine headache treatment. And sometimes within 2 or 3 minutes of the headache or of the goggles being placed on, the headache's going away. So Darren, tell us about those.
Yeah, so I got the goggles. I'll actually turn them on and get a session and treatment while I'm doing this. They do have the perforation holes inside, so I could see you guys. But these goggles,
you look like a bug.
I kind of feel like an insect. So super cool. These are considered the world's first ever low frequency PEMF goggles designed for eye and brain health. We have very small capillaries in our eyes, so it's generally really hard to get any type of recovery from any eye surgeries, macular degeneration, things like that, as well as headaches. There's a lot of studies done on PEMF with brain inflammation and stuff like that. So these goggles will actually emit a low frequency PEMF. As you can see, it was right on my eyes, right on my head. That's why they make it a lower frequency, because it's directly on your eyes and on your brain. So that's designed to run for 15 minutes, USB-C rechargeable as well. There is a airbag heat and compression massage, so it does an incredible temple massage. So we've had a lot of people tell us it's helped them with their TMJ, their jaw pain, grinding their teeth at night. It relieves a lot of tension on your head from your temples and your forehead. And then there are patented perforation holes. So it's known as the pinhole effect that optometrists utilize. So it's actually designed to, be looked out of. So you can close your eyes at night. We throw them on every night before bed. And everyone just has the best sleeps of their life. A lot of people literally can't stay awake when they're doing that goggles. But the holes are there, so you can see through it and you can read and look at things. And it's actually designed to exercise your eye muscles, the pinhole effect. So they have their own patented design. We've had some of our clients and friends tell us that they were reading things without their reading glasses, and they didn't notice it, but because they were using the goggles so much, you know, your eyes are a muscle, and like every muscle, if you don't use it, you lose it. And that's why when you're on prescription glasses, typically that prescription only gets stronger over time because that's a crutch and you're not allowing your eyes to exercise naturally. So it is a very cool device. These are only $500. So landed at your door with tax and shipping, $550 for these goggles. It's hard to even just share them. You know, me and my fiance have our own pairs. So every night we use them before bed. Her mom has always used Benadryl to sleep for decades and started just using the goggles every night and no longer needs sleeping medication. My mom too has had a lot of sleep issues and a lot of ups and downs with different sleeping pills over the decades. And both of our parents and moms are just telling us that all they do at night is they use that goggles. We'll have friends come over to our house who are nearby that have a migraine or a headache, and they'll call us and be like, "Hey, we're down the street. Can we come by and use your goggles? I have a headache." And they put the goggles on for 15 minutes, they take it off, and they're like,
Wow.
migraine's gone, like, get back to their day. And they didn't need to take, you know, whatever drug or Advil or Tylenol, you know. So it's really cool. The goggles are very convenient. I travel with them, use them at hotels, literally use it on the airplane is incredible. So those are really cool devices too.
We're going to have to do one more podcast and break open a package to show people what they can do and purchase and get these things so that they can go to our link and get it all. It's not as easy to buy from your company. It's not like we can just give them a link and they just go there. They have to go to that link and fill out some information. Then we have to do some more to get it to execute the order. But it is something we need to talk about. We need to spend about a 30-minute show on just what we have in the products here. But I know we've got to run and y'all got.
This is such great information, and it's interesting stuff that I want to try all of it because it's especially the whole brain health stuff. But then also you focus on specifically fat, and then you also focus on, you know, neuropathy. There's just so much.
Yeah.
So how many different products do you have that you're selling, Darren? That just like.
Yeah, so we have, I'd say, about 7 main products. So we have the goggles, we have the P90 and the P90 Plus, which are the 2-foot plates, the older flagship and the newer flagship with both of the wand attachments that come with it. We have the shaken massager. We also have the air filter I have over in my room. So it's called the Bama Air. It's not just a filter though. It's a negative ion saturator. So it saturates your room with anions and negative ions that you naturally get when you're at a waterfall or you're out in a rainforest, you're at a beach with shore break, you're absorbing and inhaling these nutrients in the negative ions in the air. And then we also have like a portable hydrogen water bottle that produces molecular hydrogen-rich antioxidant water. And then the vitality wand, which is something I think we would want to have a whole episode on as well. It's set up on a tripod, you angle it about a foot away from your body, and it blows hot compressed air with Dyson technology built in because they're the only ones who have the tech to make it powerful enough. And it actually blows a longer wavelength of the frequencies so it can penetrate deeper into the bones, tissues, tendons. Very powerful spot treating tool. Like that device, you know, when people have a specific part of their body or injury to heal, it blows for 45 minutes for a full session. Tripod can oscillate up or down or side to side. And that is get a lot of results with that. You're able to hit people right on the spot. It's actually designed to penetrate through clothing and even through a cast. So if someone has a cast on and they can't remove it, that terahertz wand's designed to blow the longer wavelengths of PEMF and terahertz to get it to penetrate into that bone and tissue and accelerate the healing. So those are the main products. And there's a new one on the horizon. It's called the Oli Spring. It's basically a water device designed to simulate Arctic spring water. So it has an incredible 99.9% purification system. It has like molecular hydrogen infusion, magnetization to restructure the water molecules into smaller clusters. And it also has an instant hot, instant cold water setting as well. So that's the next product on the horizon, because hydration is very important with PEMF, with all this technology. I mean, the human body is a battery. So you want to be hydrated properly. You want to have good electrolytes. The more hydrated, the better your electrolyte balance, the better the PEMF and the frequencies are actually able to really do their job within the body. So hydration is going to be a big big factor in allowing this to really optimize all of these frequencies in your body.
Fantastic. Some great stuff. The link will be in the show notes. Appreciate it, Darren. Thanks again, Dr. Duggar. And thank you again, Mike Crook. Make sure you like and subscribe to the podcast, guys, and take care. That was the special simulcast Neil Haley Show and the Mike Crook Show, guys. Take care.